Hi, this is Dr. Nicole Anderson, and I'm going to show you a psoas release laying on your back with your feet on a chair. So why is that important? Well, a lot of times lower back pain is coming from a trigger point or tender point or stiffness in the iliopsoas, which is a muscle on the front of your spine. It's also attached on the side of your spine. And so to release it, what we're going to do is we're actually going to shorten it a little more. It's already kind of short because it's gotten tight, and we're going to shorten it more. Okay, so if you're not sure which psoas is the one that's giving you a problem, then just do it for both. And what we want is we want to have some hip flexion, so you got to scoot up into the chair a little bit so that your hips are flexed a little bit. Okay, and then ideally your head would be on a pillow. I don't have a pillow here, but make sure you get a pillow to rest your head on. Okay, what you're going to do, if I'm going to treat my left one, what I'm going to do is I'm going to cross my left ankle over my right, okay? And then what I'm going to do is I'm going to let my knees fall over to the side, toward the left side if I'm treating my left iliopsoas, okay? And you'll feel it get kind of soft. If you put your finger on your belly button and move it over to the left, you'll feel it get soft in the muscles there. And then what you're going to do is you're going to just gently push down into those muscles. And you're going to stay here for 1.5 minutes, and you're going to see if you can let your fingers sink all the way down to your spine during that 1.5 minutes. You're just going to be gentle. If you want to, you can use both hands as you're just kind of gently digging down, 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 down. Don't force it. Don't try to blast through any kind of barriers. Just go to the point where the tissue stops you, and then just keep pressing gently, gently, gently. Just feeling and following as the barrier releases, and just letting your fingers sink down onto your spine. And you might feel a referral. You might feel a little pain in your back while you're doing this, and that's a good thing. That means you're releasing the cause of the back pain that you've been having. So you're just going to keep sinking down, 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 gently, 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 all the way down for that 1.5 minutes. Okay, then we're going to move it to the other side. So you're going to just let your knees swing over to the right. Don't do it into a forced direction. Just take it to an easy direction to the right. And if you have any pain in your back, then back off on how far your knees swing to the right. And the other thing is you got to make sure you cross your right leg over your left. I almost forgot. So cross your right leg over your left. Okay, now my knees are hanging out over to the right. And I'm going to put my fingers in my belly button, move over to the right a little bit. And I'm just going to press down, 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 sinking toward the spine. And I'm just going in as far as the tissue will let me in, not forcing it, never blasting through the barrier, just letting my fingers sink into that tissue and slowly feeling and following as the tissue releases and lets me in. So I'm going to do that for 1.5 minutes, okay? And then when I'm done with that, I am going to just roll over like this and come on up. And that's it.